Polaron here. Today I have a really great pleasure of introducing you to someone that I've just met, but someone that's very inspirational, I think, and quite a community leader. On the other screen, you can see Azal Ahmed. She's a Somali Australian project worker, and she's recently started with ECCV, Ethnic Communities Council of Victoria. Welcome and good morning to you, Azal.
Good morning, Eva. Thank you for having me.
It's a real privilege. Tell us a little bit more about what you do at ECCV. I know it's quite a new job, one that you've just started. So, you know, we're still gaining traction and we're developing a relationship, but it's a newly created job, I believe, and one that's very important to the community as we're coming out of COVID, as we, you know, returning to the normal, whatever that might look like.
Yep. So, like Eva mentioned, my name is Azelle, and I'm currently working at ECCV as a project worker on the community outreach project under the Working for Victoria scheme. So for those of you that have never heard of ECCV before, ECCV stands for the Ethnic Communities Council of Victoria, and it is the voice of multicultural Victoria and the peak advocacy body for 8 regional ethnic communities councils and 220 member organisations, including ethnic and multicultural organisations all over Victoria. So for over 45 years, ECCV have been the link between multicultural communities, government and the wider community. So the organisation has a strong history in advocating for the rights of multicultural communities, informing industry practice and influencing government on a range of issues, including health, employment, aged care, cultural responsiveness, equitable access and the wellbeing of families and children. So for my project, the main objective of the project that I'm working on, the Community Outreach Project, is to deliver the Working for Victoria project in line with the state government's priorities and provide tailored place-based supports to the specific needs of CALD communities impacted by COVID-19. So our role is evidently dependent on COVID rules and regulations in Victoria. So it does require us outreach workers to be on the ground and in local communities, engaging directly with people from CALD backgrounds who face a range of challenges as a result of the pandemic. So this role includes liaising with partners and community stakeholders whilst also reporting to the government. And I guess the project outcomes would then be to ensure that CALD communities' needs impacted by COVID-19 are met. And this is by delivering that local response that addresses those local needs across all over Melbourne and Victoria, and also to hopefully enhance the organisation's effectiveness and improve their overall capacity to respond to the unique needs of Victorian CALD communities. So yeah, that's basically what the Community Outreach Project is.
Azelle, you are a very articulate woman, person, advocate, leader. And just before we started the session, I asked you whether you could share any success stories. And you said, look, the job's quite new, we're still gaining traction. And I said, well, how about you? Aren't you a success story? And I think you are. I know a little bit about your background, but maybe people that are listening to us don't. Could you just give us a bit of background information about who you are and, you know, for example, the languages you speak and the community that you're part of, a little bit more about yourself.
Okay, so I'm Azal, and like everyone, like Eva's mentioned before, I speak Somali. Not as fluent as it used to be, but I do speak Somali. I understand Arabic pretty well, and obviously I'm fluent in English. And yeah, so prior to my current role, I was working as a youth mentor for 2 not-for-profit organisations, and those roles required me to work with the Somali youth and provide them the supports that they needed. And whilst I was doing that, I was also simultaneously studying a Bachelor's of Public Health at Monash University, which I did graduate from in 2019, which is quite ironic because the pandemic did break out after I finished my degree. And I think throughout my degree, I was never really sure whether or not I wanted to actually pursue public health or work in that community engagement and health promotion sphere outside of university. But it wasn't until I was given the opportunity, I think it was in the penultimate year of my degree, where I was given the opportunity to travel to Indonesia on a public health study tour. And basically this public health study tour allowed me to work with prominent health professionals, policymakers and community health workers in Indonesia to develop and implement tailored health initiatives for small populations in Jakarta and Yogyakarta. And some of the programs included teaching new mothers the importance of breastfeeding their babies, SIDS prevention and education, smoking cessation initiatives, because tobacco use was very popular amongst the island. And I feel like it wasn't until that experience, which not only improved my understanding of the complexities of global and public health issues, but it also provided me with a range of skills that I felt like I've been able to use in both the roles that I was working at the time and my current role, but also gave me that newfound interest in wanting to work or pursue a career in health promotion and community engagement. So, yeah.
Right. And so when you were studying, well, first of all, what prompted you to study public health? And I know that, you know, when you're 18, you finish school, nobody has any idea about what they want to do. But as you were studying and sort of reaching, you know, graduation, and then, you know, the real life, choices hit, how did you reconcile that? So between your studies, which is, I guess, theory, and practice, which is what you do at the moment, is that what you expected? Like, was that a pretty smooth transition?
I think it was, to an extent. So to answer your question of what made me, or what gave me that interest in pursuing public health in university, like many Year 12 students, I was not sure about what I wanted to do when I went to uni. If you have a look at my BCE subjects, they were very broad. I did the maths, I did the humanities, English was compulsory, I even did psychology subject as well. So I like a bit of everything. And when it was time for me to put in those courses that I wanted to do when I was in university, I think public health was that one degree that I kind of looked at that kind of encompassed everything. And I was like, you know what, I will just go into this. If I don't like it within a year, I'll probably change. But luckily enough, I did like it enough for me to go into my second year, which provided me the opportunity to go to Indonesia. And that's when I was like, yeah, I do like, because it gave me the opportunity to apply what I've been learning in my books to real life. So it was nice seeing, you know, you learn about those social determinants, you learn about the impacts of psychosocial factors on health and how you've got to address those determinants at the micro level and at the macro level in order to form those effective interventions. And it wasn't until I was able to actually apply that knowledge in real life that I think solidified my interest in pursuing a career in public health.
And of course, I think it's fair to say too that many people that enter this space, you know, professionally, they want to change or help people. Is that your attitude towards your work, that it's a helping profession, or is it something else?
I think for me, it's a bit of both. So naturally, I do like helping people. I think a lot of people do. But I'm that person that I really want to enjoy what I do. Like, it's nice to go out there and go to work and just do, you know, work because you want to. But I am very fortunate to be in a position where I'm applying the knowledge that I've studied in my undergraduate degree, like a couple of months after I graduated. So I think I do also find a great interest in addressing those determinants at those little levels. You know, how do social factors impact health? How do cultural factors impact health as well? Or, you know, so things like, so I think it's a bit of both. I genuinely do like helping people, but I also do have that keen interest in understanding the relationship between social, political, psychological factors and their impact on a person's health and well-being.
We've explained that really well, and what that leads me into is to talk about the topic that we kind of gathered here about today, and that is building resilience and engagement through community consultations. That's something you have been involved with for quite a while. But I'm wondering whether you could, and you know, before we came on air, we were talking briefly about what does it mean to be a community leader? Like, who do you represent? Can you be a spokesperson for the Somali community? Who is the spokesperson? What are they saying? Why are they saying it? What are their agendas? You know, there's so many things that come into play. But what has been the experience of your community, however you would describe it, through COVID? has that built that resilience? Has that made people stronger, or are there pockets of the community that are really suffering right now?
Yeah, I think obviously COVID, well, the pandemic is like no one's ever prepared for a pandemic. It is like a once in a 100-year event, I think. So in terms of like the resilience within the community, I would say, so for those, well, I think resilience is very subjective. So for people from my background, obviously, they do hold very strongly to their faith, and spirituality is also a very big thing. So I think naturally when COVID did strike and COVID happened, having that understanding that, okay, it's happening to us right now, but we do have that faith, and we do believe that, okay, by the end of this we will make it out, was something that they did hold on strongly to. However, there were those impacts of COVID that could not be prevented, like those financial issues, people losing their jobs, lack of income, mental health issues, which were a very big thing as well, accommodation and food security, which were also quite big. So I think it's not just unique to my community. I would say a lot of the Australian population, or people from cold communities in particular, did suffer from COVID. And I think luckily we're in a position in Victoria right now where we are moving forward, but it'll take quite some time. And I think our project currently right now is working on kind of being that, that middle ground, or liaising with stakeholders to help, the community get those resources that they need to move on from the pandemic.
Azelle, talk to us about sincere, genuine and honest when it comes to community consultations, because I think that if you ask the community what they need and what they think, they're going to tell you. The question for me is, what are we going to do with that information? And, in a way that's constructive, but also, encouraging and inclusive.
Yeah.
Do you struggle with, hearing what the community says and then being able to transport this into another context, which is ECCV or whatever the work that you do, in a structured and actually useful way? Are we seeing changes being made based on what the community does say? And like I said, if you ask them, they'll tell you.
Yeah, I think it's very dependent. I think one thing that we did learn very early on in our project was it's very important to be very clear with your objective when consulting with the community from the beginning. You don't want to find yourself in a position where you've promised the community something and a couple months down the line, they're asking you, okay, what have you done with that information? Where's the assistance that you promised you were going to provide to me? So I think in terms of our project, we're not service providers, so we don't provide the services ourselves. So what we had to tell the clients and the people that we were interacting with was, listen, this is the project that we're currently working on, and we've found common themes amongst cold communities that have been impacted by COVID. But we also wanted to hear your stories. What do you feel like are the problems that you're facing, and what services do you need? So I think once we were able to be honest with the community members, they were also honest with us, and I think it builds that rapport where they do feel comfortable enough to tell us what those issues are, and we give them that reassurance where, okay, if I can't provide that support to you, there are other organisations or other stakeholders within the community that do provide that assistance. And currently we have been able to make those referrals and make those connections and links between the communities themselves. So I think it's very important to be very honest about your objective from the beginning, because you don't want to leave people hanging on at the end and them feel like it's just a one-way thing where they're just giving and not receiving anything in return. So
right. So what you are describing is a two-way street and proper, genuine communication with the community. And I think I've been in Australia for the last 35 years, and I think, and sometimes I feel like we keep on reinventing the wheel. Like all the communities that were here initially, whether it's Italians or Poles or Russians or whatever, have gone through a pretty difficult journey sometimes, and there's so much to deal with when you come here as a refugee or a displaced person. And I think that sharing of knowledge, perhaps that doesn't happen. I know there are quite a few projects out there, for example, in the Jewish community, that they mentor other communities that are more emerging and establishing themselves. But would you say that sharing of the knowledge and experiences and kindness should happen more often, like people that have gone through that process like I have, perhaps should give more,
Yeah.
so that other communities don't have to go through the same, harrowing experiences sometimes.
Yeah, definitely. I think, like you've mentioned, yeah, there's been a lot of communities new and emerging over the years, and some of them are quite established right now. And it is important, very important to share that information so other people don't go through the same thing. But I also feel like adversity is sometimes inevitable. So sometimes communities have to go through things themselves to know exactly how to come out of it. And also, like public health initiatives or programs that may have worked for a certain community are not necessarily going to work for another community, or work for another population down the line. So I think it's important to take what's worked and utilize those interventions or initiatives that have worked for other communities, and maybe tailor it to fit the communities that you're currently working with, and also use that strength-based approach and see what the strengths are within the communities themselves, and utilize that when informing policies or interventions that you do want to make or for the communities.
Azal, indirectly, you mentioned a very important point. I think some of us anyway, are sort of stuck 20 years ago, where we think that, for example, the Somali community is emerging. Nothing could be further from the truth. We see community leaders such as yourself that have were born here, potentially are educated, are making a mark on the society, and hopefully we're giving you a voice to speak. Do you feel that you've been given room in that conversation, or do you have to use your elbows to, push yourself in and I don't want to say have punch-ups with people, but have, you have to ask to be included still, or not?
I'd say, it's so subjective. It depends on where I am, who I'm with. And I think not only being Somali, even as a woman, like sometimes I remember just graduating from university, and I was working as a volunteer during the weekends every single week for about 3 years. So by the time I graduated, I had this knowledge of, how to work with culturally and linguistically diverse communities. And I also had that academic background in public health. So when I went out there and wanted to apply for these entry-level roles, and that I felt like I was well equipped for, people would just tell me, I'd be like, no, you've got too much experience. We're giving this to someone that doesn't know anything. And then when I'd apply for maybe other roles, and then when you'd apply for maybe other roles that you're like, okay, I think I've got the knowledge and I do have that experience under my belt, they're like, no, you're still quite young. So I think it's very subjective. I'm very fortunate that right now I have been given the chance to actually apply what I've learned, and I'm very fortunate that I am in this situation. But I think there's a lot of different factors, not only my ethnic background. I think my age is also a big thing. People just kind of assume that you're younger and you're not aware of that as much. And I think also being a woman, sometimes I just remember I kind of underselling myself, just thinking, oh, maybe I'm not well equipped to partake or, do these roles. And they're like, no, you just still apply for it. You don't know what's going to happen. So I think it's very important to not look at the negatives, throw yourself out there, immerse yourself into these opportunities, because you never know what's going to happen. So it's very easy to sit there and be like, nothing's working out for me, but you do have to take that plunge, and there's always an opportunity out there for you. You just got to not give up.
And let me tell you, from my point of view, I think also ECCV is very lucky to have you. So I think, we've not met, but I think it's amazing that someone like you had been given this position. And I think for me, it's really unfortunate to hear that we're still going through the same thing that I've gone through, where you are either over-experienced, under-experienced, I don't know, the wrong height, the wrong color, whatever.
There's always something.
So I think this hasn't changed much, and we still have to fight for what's right. And I think what you're describing is that, and I'm very pleased that you've been able to find your space where you are very much respected. And I think ECCV is a great organization for that. Just going back to the engagement and resilience, could you maybe just give us a couple of points of how those of us we've got quite a few people watching us and a lot of questions, let me tell you. I wanted to know from you if you could give us 3 points of, maybe of things that you've learned over the last few years. How do you engage a community effectively or genuinely? So you did talk about honesty and setting the scene. Anything else that you could share with us?
Yeah, so honesty, building that rapport is very important. I think taking that strength-based approach, not looking at what the community is lacking, understanding that communities themselves know what they need and what resources they require. So I think it's very important to not go into a community or not go into a position thinking, okay, you know what, I know what the problems are and this is how we're going to tackle it. I think it's important to include the community in that decision-making process and make them feel empowered as well. I think empowerment's a very big thing because I feel like through empowerment, people are more likely to partake in those behaviour changes or involve themselves in the community because it does build that self-efficacy and it's more long lasting. It's very easy for someone to sit here and be like, okay, I need you to do this, this and that. But at the back of your mind, you're like, I'm not going to do it because you want me to do it. But when you provide communities with those resources, with those skills and utilize their strengths, they're more likely to want to partake in anything that you want to do and give you the information that you need to better both yourself and them. I think it's important to focus on social cohesion as well. It's very easy to be divisive and break people apart. But I think when people, it sounds very corny, but when you bring everyone together, you're more likely to have that those shared values, and people are more likely to listen to you and want to do better for themselves. And so I think empowerment's a big thing. Social cohesion is another one, and utilizing strength-based approaches is also another thing that I've learned from my mentors and the people around me that do.
That's a very wonderful wrap up of what you can do. But what are some of the barriers to that? Obviously, language is one of them, potentially literacy. And I think technology is another thing that we sort of take for granted. And, I remember when we first started these live sessions, we were so nervous with Andrea because technology, even though you work with it, every day, things go wrong or, it's very... it brings anxiety to people. So what will be some of the other barriers that you've encountered to that genuine engagement? And also the other question is, are the governments finally listening? Is that, are you finding that we've now kind of all learned our lesson, and we know that unless we engage communities at a genuine level, there's always going to be exclusion, yeah?
Yeah, I think to an extent, I think the government is listening. There's always room for improvement, but I think it is listening. I also believe that the barriers to change would be simple barriers like motivation. Sometimes you just need to motivate the community. People need to feel, that they can do something, building that self-efficacy from within. And I feel like doing it with one person or one individual can have that domino effect where everyone else kind of just goes, okay, you know what, if they can do it, then I can do it too. I think literacy is definitely, health literacy is also a very big one, which was very evident during COVID. Digital literacy is also another one. I think we're going into a time where social media is being utilized more than ever before. So I think it's very important for people to catch up. But something I've seen with a lot of the elderly people that I've had to contact recently is that they're not comfortable with using social media. I remember I gave one of them a ring and I was like, listen, I'm working on this project. And she was like, oh, thank you so much. These are the problems that we're going through. And I was like, okay, I'm just going to send you an email, kind of outlining what it is that we're doing. And she's like, no, don't send me an email. Give me a ring back. And I'm like, I don't think I can call you back. And she's like, okay, maybe then give us like a letter. Send me a letter. Right. And I'm like, okay, so you've got to, knowing what engagement tools work with certain demographics of communities is very important. I think those are the pretty big ones. I think mental health is also another big issue, predominant thing that does need to be focused on as well. So,
because I think that the worst thing you can do is translate a whole heap of resources, put it on your website, and hope that people are going to find it. And in talking to communities, you really do have to find out how they communicate, how should the information be disseminated in the best way, so it actually does the job. So if you've spent money on a translation, don't just post it somewhere where it cannot be found. It does require that, what you just talked about. Azelle, we have many questions. I'm going to hand over to Andrea, but before I do, I have a personal question. And
Yeah.
that is, what does your family think of you and your success? Are they extremely proud and you know, are they cheering you on from the sidelines, or what do they think?
No, I think my parents are really proud. I am the eldest child, so yeah, so it's like that added pressure. But I think my parents are always proud of what I do, and they've always given me that room and that space to grow, and kind of always trusted me to make my own decisions. And for my parents to see me actually go to university and actually be in a position where I can apply what I've learned makes them super proud. And I'm very grateful for their support, because I do know a lot of people aren't fortunate enough to be in the same position. So I think I'm very grateful for my parents, because I don't think I'd be in the position that I am in today, or even be here today, if it wasn't for them. So they're always pushing me to step outside my comfort zone, you know, take those opportunities and always go for it. So yeah, I'm definitely very grateful and proud of my parents just as much as they are of me. So yeah.
It's amazing. And, you know, I've said it already, but I'll say it again. We're very privileged to have you speaking to us today. And what I'm going to do now for the next 5 minutes, because believe it or not, the 25 minutes we had allocated has gone just like that. You are very, very engaging, a very interesting speaker. Over to you, Andrea, with some questions.
Thank you so much, guys. There's a question for Azal in relation to her motivation. So what motivates you, Azal, to do or to, you know, wake up every day and work towards the communities?
Oh, that's a nice question. I think my motivation is always changing. I think especially right now during COVID, more than ever, I just feel like it's very easy to sit back and be in that position where you're like, you know, oh, things are always going wrong in my life and there's nothing I can do about it. But I think just having that drive, for me, my biggest motivators would be I look at the people before me, and I just look at my parents and everything they've sacrificed for me, and I'm just like, I've got to make it not only for myself but for them and the rest of my family as well. So I think family is one of my biggest motivators, but also me, like I want to see success. Like I want to do well and be proud of what I do, and also just be content. So it doesn't have to be anything major, but I just want to feel good doing what I do. So I think that's my biggest motivator.
Thank you. So going back to those communication channels we were talking about, what are those channels that do you think are better to reach out to those in the Somali community?
I think it's very circumstantial. It depends on who you're trying to reach out to. So if you're wanting to reach out to the youth, the people that are a lot younger, then social media would be a big one. I think a lot of the older generation are also hopping on social media as well, which is pretty interesting and nice. But I think for them, things like, you know, WhatsApp and those little, like just messaging them is also a nice tool as well. But a lot of them are becoming quite tech, you know, savvy when it comes to things like Zoom or Microsoft Teams and things like that. So I've seen my parents use that and they're doing pretty well. I think they just need to be taught how to use it, and they're like good to go. So yeah, I think it's just very dependent on who exactly within the Somali community you're trying to reach.
Thank you so much. Is it a challenge for you as not to be able to meet face to face with the communities at the moment?
I think it is a bit challenging. There's obviously, I think communication goes beyond verbal communication. I think non-verbal communication is a very, very big thing. But in my previous role, I was working as a customer contact officer. So I was speaking to people daily, day in and day out. And I think that's kind of, that role has definitely taught me how to pick up on those cues, you know, be emotionally intelligent and know what people are saying and thinking. So I think it is a bit of a challenge because as human beings, we are quite social. But there's always, you know, other mediums that you can use. So you can meet people over Zoom, which is not necessarily in person, but you can see, you know, those non-verbal cues and things like that. So it is a bit of a challenge, but I'm someone that kind of grew up in this generation where social media is a big thing. So for me, it's like I'm not too much by it.
What do they call you? Like a digital native, yeah? Is that how you describe it?
Yeah, I don't know, but I do like that everyone's hopping on social media now. So
look, and I think, you know, you're absolutely right that if you look on the bright side of anything that happens, such as the fact that we would never have this live session if it wasn't for the pandemic, because we wouldn't think of it. You know, we do have to look for creative ways to communicate and engage people and share information. Definitely. So on that note, I wanted to give you a couple of compliments, if you don't mind. And one is that you've got this amazing energy and optimism. And you know, if my world is in the hands of people like you, then I'm good. Then I can retire. Not that I'm planning to. I'm planning to work till I'm at 97 or 112. I haven't decided yet. But it is great to see that you are not just being given opportunities to shine, but you're grabbing them and you actually are able to explain things so well, much better than I can ever do. So I really wish you all the best. Do say hello to your parents, and from me, you can tell them that they must be very proud of you, because I can see just through that optimism and you know, not looking on the downside of things, but really looking at communities and at your own work, and you know, taking charge and seeing, okay, what can we as a community do together. So from me, thank you, but I'm going to hand over to you just for the last few words. We do have a lot of other questions which we haven't been able to cover, but we'll reach out to you and let you know what they were, and we wish you best of luck with your not so new job, and best of luck for 2021. So over to you, Azelle.
No, thank you so much for having me. This is my very first guest speaker appearance, so hopefully the first of many. So I just want to thank you so much for giving me this opportunity, and for everyone else that's listening for tuning in. And if you guys do have any other questions, you can reach out to me on my LinkedIn, or maybe send those questions over to Andrea and Eva, and they will pass them over to me. And also feel free to go on your computers and mobile phones and search up ECCV and have a look at the website, because there's a lot of amazing publications that have, you know, information about the common issues and themes that a lot of the people in the community have experienced. So yeah, but thank you once again for having me. I do really appreciate it.
Same here, Azelle, and I do hope that we can put 2020 behind, forget that it's ever happened, and next year hopefully we can meet face to face, because I know that ECCV organises a lot of really fantastic events, conferences, and we've missed out, but we can you know, do it even better next year. So thank you on that note, and thank you, Andrea, for organising. This has been wonderful. Have a great day, everyone.
You too. Take care.
Thank you.